that spinach or chard or what else did he say? There's a few other greens that release nitrates, and he wants you to have the vinegar. I mean, the spinach with the balsamic vinegar 6 times a day. But practically, it's very difficult to do something like that if you're a truck driver or, uh, you know, you want to eat. You try to eat as well as you can or when you can. So I I took it and I instead of putting one handful 6 times a day, I do 3 or 4 handfuls 2 times a day with the balsamic vinegar. I eat it raw. He suggested to boil it to make it softer or something. I'm not sure exactly why he wanted to do that, but I was like, I'm gonna eat it like this. So I've been doing that, and I noticed in the first couple of weeks where I kind of felt like it was cleaning my arteries. It was opening things up, and the the nitric oxide that you have in your system, when you're 20 years old, it starts to reduce in some people. I'm not sure if it works that way with everybody, but in most people, or let's say some people, it starts to reduce. So you have if you have a nitric oxide deficiency or a level that is not where it should be for your age, it's probably because your body's not producing it. So in order to um, build up my nitric oxide and have it constantly building up in my body, I eat um, those 2 plates of spinach per day. One will be after my breakfast, and the second one will be after my dinner. And so far, so good. The only issue with that diet is it does cause constipation. And so, in order to um, minimize the effect, I eat gala apples, right? I eat half an apple twice a day, and also I'll eat pomegranate. So that is what I learned from Dr. Esselstyn. Although he advocates for an all plant-based diet, I just couldn't do that. If I was having that much issue with constipation with just eating spinach, then I don't know what the heck would happen to me if I went straight all vegetable. So, okay, so that's my morning. And then in the afternoon, I will have 2 slices of bologna with tomato, half a tomato on either bologna piece, with mustard and cheddar cheese. A block of cheddar cheese. I'll eat. I usually eat about this large of a piece of cheddar cheese that's this thick. And so that, and one, I will eat a full orange at that time also. So after I eat that, I move on to my dinner time, which happens at, usually I eat dinner at 7 o'clock because I want to eat my dinner at exactly the same time every single day. And I want to eat my breakfast around the same time every day. Sometimes it's not possible to eat it right at 7:45 or 8 o'clock, but my dinner is constantly at 7 o'clock. So for dinner, I eat chicken, a whole chicken, like a Costco chicken. I'll eat half of that with um, um, uh, vegetables and potatoes. And I'll eat, other days I'll eat ground beef and potatoes, or I'll eat ground beef with like sour cream and or yogurt, and I drank uh, one can of pop, a full can, and I figured my blood sugar would just spike like crazy. I did in the 3 months that I've um, been dealing with these issues. My blood sugar only went up 3 points after drinking that full can of pop. So when I look at when doctors or anybody else says that, oh, blood sugar is related to how much sugar you drink or eat, it's not. In my experience, in my opinion. My opinion is that vegetable oil causes your blood sugar level to multiply by about 2 times for sure. And depending on what you eat, like with potatoes, um, um, I mean, with breaded food, it seems to do almost 3 times what you eat. So if your blood sugar is 3.7 and it goes to 11, that's like an 8, right? And I've eaten bread, 2 slices of bread with my food, and had my blood sugar rise to about 3 points higher than when I started out. So in the case of breaded food or bread, it seems to cause it to go almost 3 times higher. So from 3.7 to 11.7. Now, with like candy and stuff like that, it only seems to go 2 times higher. And when you don't have any vegetable oil in your system, it only seems to rise 2 to 3 millimoles per liter. So vegetable oil was created in 1866. There was no heart disease, no diabetes, no cancer back in those days. After about 15 to 20 years, they started to see heart disease, cancer, and diabetes. So there has to be a cause and effect there. And I don't think there's any healthy vegetable oil, honestly. I think that it's the reason why your arteries clog up. It's the reason why, like I said, you get diabetes. My theory is this: if you're a type 1 diabetic, maybe it's because you are intolerable to vegetable oil right from the beginning. So whatever your mom ate while you're in the womb or whatever, or yeah, in the womb, that caused you to become a diabetic right away. So the second type is type 2 diabetes. And I believe that eventually you become intolerable to vegetable oil also. So there's a cause there, which is the vegetable oil causes your blood sugar to spike. And I'm thankful that I figured this out only 2.5 months into my diabetes, because now I've completely eliminated vegetable oil, unless, like, when I go to sleep and my blood sugar is at 4.5, I will not eat any vegetable oil, like no potato chip. If my blood sugar is around 4, then I will eat one potato chip. Anything below 4, I will eat one potato chip. And so far that's working well for me. And I'm hoping that this video really helps a lot of people to understand that vegetable oil is more than likely the cause of diabetes or insulin resistance, basically. Insulin resistance. And heart disease. Because as a 47-year-old male, I have never drank any alcohol. I've never done drugs. I've never smoked. I used to play ball hockey or floor hockey once a week. I used to play basketball in high school. I used to play volleyball in high school. I used to play soccer in high school. Um, I go to sleep on time. I wake up on time. Uh, I I never I even though um, I did have no idea about vegetable oil, so I couldn't really protect myself prior to becoming a diabetic. So, and even then, I would eat vegetable oil sparingly, except with my fries, right? So, and we've had an air fryer for like 2 years now. So even then, I had stopped. So, um, what else can I tell you about myself? Yeah. So the only thing that I can think of that would have caused my heart attack and this diabetes to occur is vegetable oil, because the only time I drank pop was when I went to parties. That's it. Period. I never drank pop. So if sugar was the cause, why would it happen to me? Because I barely ate any sugar. I didn't eat Coke. I mean, I didn't drink Coke. I didn't eat much cake or like donuts or whatever. Like, so I was confused as to what it could be. But now I know. I'm positive that it has to do with vegetable oil and the lack of nitric oxide. Maybe the vegetable oil kills your ability to produce nitric oxide also, right? So I don't know, but this is what I'm thinking. And I just wanted to get this out to anybody that would want to know about it, and anybody that wants to try and do what I did, which is monitor yourself, um, completely cut out vegetable oil. Any kind of, if you've had a heart attack, for sure, but even if you haven't, just try and cut it out and see if you're a diabetic, just to see if it affects you, because there's certain people like children and whatnot that are not going to be affected by it for 15 or 20 years, like my own children. But I'm going to try my very best to make sure that it never does affect them. Like, they still eat fries and whatnot, but it's not like every day or anything. And those are only from like McDonald's or Burger King or whatever. We go there maybe once a month. Um, I don't eat buns anymore. Oh, I forgot to mention that. I don't eat carbs, period. I don't eat bread. I've eaten 2 slices of bread in 3 months, and it did not go great because there's vegetable oil in bread, right? Because I don't pick, like, even the cauliflower pizza that I got from Costco. There was vegetable oil in it, and there shouldn't have been. So that did affect my blood sugar, so I stopped eating that also. So um, thank you for allowing me to tell you my story, and I'm hoping that you'll gain knowledge from this. I'm hoping that. Oh, one thing I forgot to mention is I still don't believe that red meat causes cancer. Um, I don't I don't know how good fish is for you, but I'm still eating meat, um, because as no as nomads, when we were evolving throughout time, we've always been meat eaters. The best fats to cook with are animal fats. Using butter for cooking or sauteing or whatever is better than any kind of vegetable oil you can use. I'm not a real great cook, but there's got to be videos online for what you can use. Like I heard about beef tallow. I've heard about lard, and I've heard about, well, I know about butter for sure. So those are the things you can use to cook with. But just try and not eat any vegetable oil and see how your system feels. Honestly, it's been 2.5 months. I have not had any recurrence of chest pressure or anything like that. I was supposed to have a bypass surgery, but my way of thinking is that if I don't have any symptoms and I don't feel bad, my blood pressure has dropped to almost 120 over 80. It sometimes even goes lower than 120, so sometimes it's 110. And my heart rate's in between 70 and 80 beats almost constantly. Um, my blood sugar I've been able to bring it all the way down. Uh, like I said, my morning blood sugar is usually between 5.2 and 6.3. My the blood sugar level that I have when I go to sleep is going to be either 4.3, 4.5, and if it's not below 4, I won't eat this one potato chip. But if it is below 4, I will eat this one potato chip. And I've had no more uh, sweating episodes. So, all right. I think I've spoken long enough. Thank you so much. Um, okay, the only thing I would like to say is please share this video just everywhere you want to, right? I don't really, to me, it doesn't matter if I get any subscribers at all because I'm not trying to make money from this. I'm just trying to give you my journey through heart disease, diabetes, and the relationship with blood sugar and vegetable oil. Thank you very much, and I hope you have a great day, week, month, year. Thank you.